Two. Hey guys, this is the endocrine system, and listen up. I'm going to tell you what you need to know. So let's get started. Okay. I have included in this PowerPoint terms that you need to know. So that's what the first two slides are. And also acronyms that you need to know. Okay. And so let's get started here. What is the endocrine system? The endocrine system controls all the processes in the body, and it's all about hormones and chemicals. And you have glands all through your body, and each of them contains specialized cells that secrete hormones. And endocrinology is the study of the endocrine glands and their secretions and disorders, etc. So, organs of the endocrine system. Really, the primary organs of the endocrine system are in the brain. And it's the pituitary, which is the anterior and posterior pituitary, the hypothalamus, and the pineal gland. You also have your thyroid gland, which, by the way, and you should know this, is the only endocrine gland that you can actually palpate. It's right here in your throat. Your thymus gland in the middle of your chest. You have adrenal glands, one over each of your kidneys. You have your pancreas, which is endocrine and exocrine. And you have, if you're a woman, you have ovaries. If you're a man, you have testes, okay? Endocrine glands are ductless glands. Make sure you know that, okay? They're ductless glands. They secrete hormones right into your blood, okay? Exocrine glands secrete hormones and chemicals into ducts, not directly into the bloodstream. You need to know the difference. So don't forget that. Okay. Next. So we talked about the fact that they're ductless glands and exocrine glands. Examples of exocrine glands: your sweat, breast milk, bile, tears, pancreatic fluid. Those are secretions from the exocrine glands. Okay. Hormones and everything in your body has to do with hormones and chemical receptors. When we talk about hormones, hormones are either steroid or non-steroid. Okay. You don't really need to understand where they're coming from. Like steroids are derived from cholesterol and fats, lipids, right? You don't really need to understand this part. So I'm going to forge ahead and we're going to talk about the pituitary gland. Think of the pituitary gland as either the king or the father, right? Because the pituitary gland controls all the other glands, but not without the okay from the hypothalamus. So that's the mom or the queen, okay? All right. So the pituitary and the hypothalamus kind of work together. And the pituitary is really kind of like two different glands. The anterior, which is the adenohypophysis, and the posterior, which is the neurohypophysis. Okay? All right. Say those words 3 times fast. So let's talk about the anterior pituitary. The anterior pituitary is the larger one, okay? And it secretes releasing hormones and inhibiting hormones. So some hormones stop the action of other things, they're inhibiting hormones, and some stimulate the action of other things, okay? So just understand that. It's going to make sense, I promise. The posterior pituitary, a little bit smaller, is made mostly of glandular tissue, and it produces things like antidiuretic hormone, ADH, and oxytocin. Oxytocin stimulates contractions of the uterus when you're having a baby, also triggers release of breast milk, right, when you're lactating. ADH, also known as vasopressin, acts on the kidneys and maintains fluid balance. So what it does is, think about it, antidiuretic hormone. If a diuretic makes you pee, an antidiuretic makes you not pee. So antidiuretic has you hang on to fluid, like reabsorb fluid, okay? So the hypothalamus, here are the hormones that releases. Gonadotropin releasing hormone, which makes the body secrete FSH and LH, follicle stimulating hormone and luteinizing hormone. That has to do with the production or the release of eggs for women and the production of sperm in men. Thyrotropin releasing hormone promotes the secretion of TSH, thyroid stimulating hormone, which goes to the thyroid and makes the thyroid produce its thyroid hormones. Corticotropin releasing hormone promotes the secretion of ACTH, adrenocorticotropic hormone. Prolactin releasing hormone promotes the secretion of prolactin. And that has to do with lactation in milk. Prolactin inhibiting hormone stops the secretion of prolactin, and growth hormone releasing hormone promotes the secretion of growth hormone, which you have mostly when you're a child because that's what makes you grow. Okay? So what does the endocrine system really do? It has to do with growth and maturation. Also has to do with how your body responds to stress. Maintains your metabolism, your metabolic rate, and what happens with nutrients that you eat, where they go. Regulates your sugar, your glucose, and it maintains the pH of your body fluids. Okay, it does a lot. Has to do with reproduction. It produces sex characteristics, reproductive processes and birth processes, normal growth and development, makes you lactate, and influences our sexual responses. Pituitary gland, right? The hypophysis. This is more about the hypophysis. It's located in the sella turcica, and it's the anterior and posterior lobes. We talked about that. And the hypothalamus, like I said, is the queen. The book calls it the integrator. I like calling it the queen or the mom. It's little, but it really does have a big job and promotes the secretion of all these different hormones. So the anterior lobe of the pituitary sends out ACTH, GH, TSH, FSH, LH, prolactin, PRL, and lipotropin. Okay. There are a couple charts here that you can look at. I don't really care for them. I'm going to skip through the charts and I'm going to move ahead here. And I'm going to go to the thyroid gland, which is the first one on our list. Thyroid gland is right here. Okay. If you tilt your head back and palpate here and swallow, you can actually feel your thyroid gland. Your thyroid gland kind of controls your metabolism, your metabolic rate. Because if you have a problem with hyperthyroidism, everything in your body is fast, fast, fast. You'll have hypertension, won't be able to sleep, tachycardia, all those things. If your thyroid is underactive, hypothyroid, you're going to feel sluggish and slow and tired all the time. So the thyroid is very, very important. Okay. It's the largest of all the glands. And what does it secrete? T3 and T4, thyroxine and triiodithyronine, and also calcitonin, right? So, and these things help regulate your metabolic rate. Okay, very important. Calcitonin actually helps regulate how much calcium is in your bone versus how much calcium is in your blood. Balances it out. Okay. Your parathyroid glands are itty bitty teeny tiny on each side of the underneath of the thyroid, and they secrete parathyroid hormone. Makes sense. And that regulates calcium and phosphorus, right? Pulls calcium out of the bones into the blood, and also affects the kidneys by making the kidneys make calcitriol, which has to do with calcium balance, electrolyte in the serum, in the blood. So calcium homeostasis, this is a great chart, okay? We start at the top. We say if there's too much calcium in our blood, the thyroid will release calcitonin, and that will move the calcium from the blood to the bone, right? And then the levels of the calcium in the blood go down to get it to a normal level. On the other hand, if you don't have enough calcium in your blood, the parathyroid releases parathyroid hormone, and calcium will then move from the bones, the kidneys, and the intestines into the blood. The blood level will increase, and you'll have normal calcium levels. Balancing act. It's going on all the time. Okay. Your adrenal glands, one on each of your kidneys, okay? They have two parts, a cortex and a medulla. They secrete different hormones. We're going to talk about what they do, okay? Catecholamines like epinephrine, norepinephrine. Think of them like adrenaline, okay? They produce that fight or flight response. They're the ones that, oh, part of the sympathetic nervous system, get you jacked up. Also, the adrenals produce dopamine, which has to do with mood, right? And neurological function. And don't worry about enkephalins because no one's going to ask you about it. So there's a nice picture of the adrenal gland. That's the kidney. And there's the adrenal gland that sits on top of the kidney. Okay. Then you have something in your brain called the pineal gland, little itty bitty tiny one. The way I remember this, the pineal gland makes me pine for sleep. That produces melatonin. Okay. And melatonin has to do with our sleep-wake cycle, right? Kind of tells us when to go to sleep and when to be awake. It also has a little bit of an influence on the temperature of your body and cardiac function, and they believe a little influence on reproductive function. But the big thing is the pineal gland, melatonin. You need to know that, okay? And there it is, teeny tiny, see? The gonads, which I find to be a funny word, are the glands of reproduction. In a man, they're the testes. The testes produce sperm and testosterone, which is the male sex hormone. In a woman, the ovaries produce estrogen and progesterone, which are the female hormones. And here's a fun fact. Women are born with a finite number of eggs in their ovaries. You don't make eggs. You have them and they mature. Men, on the other hand, make sperm with an axe in their head till the day they're dead. Okay. So there we go. We talked about that. Now the pancreas. The pancreas is a big deal. The pancreas is an endocrine gland and an exocrine gland. Okay. So it, as an endocrine gland, it has alpha, beta, and delta cells. Alpha cells secrete glucagon, which is a form of sugar. Beta cells secrete insulin. And that is important for you to know, right? Insulin, because when we talk about diabetes, right? And the delta cells secrete somatostatin, okay? And we'll explain this in a minute, okay? Glucagon. Glucagon is a kind of a form of sugar that converts amino acids and fatty acids into glycogen, which turns into glucose, okay? So glucagon will bring your blood sugar up. Insulin brings your blood sugar down, okay? That's the one line you need to remember, okay? That's a picture of the pancreas. And so the pancreas, like I said, we talked about its function endocrine wise, but exocrine, it secretes into ducts into the intestines, amylase and lipase. They're digestive enzymes that help your body digest and metabolize fats and starches. Okay. So that's the exocrine function of the pancreas. How do we keep our blood sugar in check? Here's how the body works. You eat. After you eat, your blood sugar goes up because you eat and the food actually goes into the intestines and the sugar gets absorbed into the bloodstream. Now your blood sugar goes up. When your blood sugar is elevated, it stimulates the beta cells in the pancreas to start making insulin. And then the insulin triggers two things to happen. It stimulates the cells, all the cells in your body, to take in the glucose for food, and it stimulates the liver to take in whatever's extra or left and store it. By the time this is done, your blood sugar levels are back to normal, right? This is how it works in a healthy person. Is the following statement true? In type 1 diabetes, insulin and amylin are produced in insufficient amounts. I don't know why they're asking that question now, but that's false. In type 1 diabetes, there's no insulin. In type 2 diabetes, there's insulin, but not enough. Okay? The thymus. The way I remember the thymus gland, T cells are trained in the thymus. Okay? So assist in the maturation of T cells. When you're a child, the thymus is big. As you mature into an adult, the thymus will actually decrease in size. T cells are a type of white blood cell that we have. And the understanding with autoimmune disorders, which is where your immune system's attacking you, is that something goes wrong when the T cells are being trained in your thymus gland. So your T cells, your white blood cells, are supposed to know what belongs to you and what doesn't. So if you expose yourself to some kind of a pathogen, a virus or a bacterium, then your white blood cells are supposed to go after it, attack it so that you don't get sick, right? That's our defense. With people with autoimmune disorders, what happens is, for whatever reason, and we're not sure why, their white blood cells attack them, their own stuff. We don't know why, okay? But there's the picture of the thymus gland right there, okay? Just beneath your sternum. Okay. There's also some hormones that are secreted in your GI tract, your liver, and the placenta and the uterus. We're not going to get into these in great detail now because once we get into med surge, we'll talk about some of them, but we don't need to talk about all of them. The kidneys make hormones, the heart makes hormones, and most tissues in your body make some type of hormones, especially leukotrienes and prostaglandins, and we'll talk about those. The endocrine system and the nervous system, endocrine system and circulatory system, endocrine system and digestive system. The bottom line is that the endocrine system has to work in concert with each of those to keep your body in homeostasis, right? Remember homeostasis? Everything's in equilibrium. And a lot of it works on the feedback loop. Remember that? Negative feedback, positive feedback. Just remember it this way. Negative feedback is when there's a stimulus and your body produces something that opposes it, right? Versus positive feedback where there's a stimulus and your body makes that stimulus happen even more. Positive feedback example, you're in labor, your uterus contracts, oxytocin is produced, it makes your uterus contract more. That's positive feedback. Negative feedback, you go outside and it's cold, your body starts to shiver, and that's going to bring your temperature up. That opposes the cold. That's negative feedback. Excuse me. There are lots of endocrine disorders. When we get to med surg, we'll talk about them. Addison's disease, Cushing's disease, diabetes insipidus, syndrome of inappropriate antidiuretic hormone, and type 1 and type 2 diabetes. Okay. And there's also something called a pheochromocytoma. So you're in for a lot of fun, guys. Okay. And then to end this, aging, other people, not me. Okay. Aging in the endocrine system. Hormones, the development and production of hormones decrease. Okay. Reproductive hormones decrease, thyroid hormones decrease. Oftentimes you'll see people with hypothyroid issues when they get older, decreasing in pancreatic secretions, which has to do with digestion. Okay. Here's a question. Endocrine disorders in the elderly are not a result of, and let's go to the answer. They're not a result of tiredness and lethargy. They're a result of the changes in the hormones, the decrease in the production, and the decrease of the secretion of these different hormones. And that's it. So that is your basic overview of the endocrine system. Pancreas, thymus, pineal gland, anterior, posterior, pituitary, hypothalamus, adrenals, and gonads. All right? I hope you had fun. Till next time. See you later.